Let's get started. Hi, everyone. This is Patty Jean McCahill. I'm the Development and Marketing Director here at Feeding America West Michigan, and we're so grateful you could join us today. I'm joined by Ken Estelle, our CEO and President, and Craig Gundersen, Professor from University of Illinois. I'm going to just start with a quick poll and to see participants. Okay, so we've got a nice mix of people between our food bank staff, agency partners, community partners, and thank you to our board members that are on. So I'm going to turn it over to Ken to say a few words.
Yes, well, good afternoon or hello to everybody. Thank you again so much for joining us. This is, I think, the third in our series of Hunger Summits that are celebrating our 40th year as a food bank. Feeding America West Michigan began in April of 1981 with a pastor named Don Eddy, who saw crops on the side of in the fields and on the side of the road that farmers were not harvesting, and he requested if he could glean those and give those to the people in need. And that actually started what it was then called Gleaners of West Michigan. We've since joined the national organization, which at that time was called America's Second Harvest. So then we were Second Harvest Gleaners of West Michigan, and then subsequently a Second Harvest changed the name to Feeding America. So now we are Feeding America West Michigan. And so we've been serving 40 counties in Michigan for 40 years. And so we're really happy to celebrate that today. And I'm very happy to introduce our speaker. Before I do that, though, I just want to remind you that the final in our series of Hunger Summits is coming up on July 9th. So if you're able to keep that in mind, on July 9th, we are going to be talking about the importance of nutrition assistance and fighting hunger with Professor Diane Whitmore Schazenbach from Northwestern University in Evanston, Illinois. So please join us on July 9th for that. But today we are very honored and excited to have Professor Craig Gundersen with us. Craig is ACES Distinguished Professor and Director of Undergraduate Studies in the Department of Agriculture and Consumer Economics at the University of Illinois. And he's on the technical advisory group for Feeding America. And we really appreciate your service to Feeding America, Craig. I know that that's been invaluable in our work. And he is the lead researcher on Feeding America's Map the Meal Gap project, which if you have not had opportunity to look at that, you can either Google Map the Meal Gap or go to the Feeding America website, and you'll see recent release of Map the Meal Gap, which has been done with the leadership of Professor Gundersen. So thank you again for that as well. And he is also the managing editor for Applied Economic Perspectives and Policy. He is a roundtable fellow of the Farm Foundation and a faculty affiliate of the Wilson Sheehan Lab for Economic Opportunities at the University of Notre Dame. And he's a research fellow at Baylor Collaborative on Hunger and Poverty. And his research concentrates on the causes and consequences of food insecurity and on the evaluation of food assistance program with an emphasis on SNAP. I don't know, I'm assuming that gives you a ton of free time, Craig, to between all of those items. So very, very important work, and it's incredible that as one person you can do all of that. So again, we're very honored to have you talk to us today about food insecurity in Michigan during and after COVID and what can be done about that. So with that, I would turn it over to you, Professor Gundersen, to share with us what you think about Michigan, about food insecurity in Michigan. So off to you.
Okay. Ken, thank you so much for inviting me to this. And Patty Jean, thank you also so much for inviting me. This is fantastic. I mean, I'm a huge fan of Feeding America. So it's always an honor for me to be able to speak with all the great people working there and supporting, in this this food bank or any food bank that I talk to. So it's really, really great. So I'm very happy to be here today. I'm going to be talking about food insecurity in Michigan before, during, and after COVID-19. What can be done? Part of the reason I'm talking about this in this context is that there was this impression that things were a lot worse during COVID than they were before or after, or will be after COVID. In fact, COVID really wasn't that bad in terms of the experience of what happened to food insecurity in the United States. And I want to talk about that. I think this is really, really important for our discussions about food insecurity in the United States and food insecurity in West Michigan. Insofar as we have to keep people aware that food insecurity was a big problem before, and unless we do something, it's going to be a big problem after. What I'm going to be talking about today is first, how we talk about food insecurity. Secondly, what are some of the key determinants of food insecurity, especially pertinent to Michigan. And third is that I will be talking about a solution to food insecurity, which is simple and straightforward. In other words, any food insecurity in our country is a simple and straightforward task. I am scheduled to speak until 2 Eastern, which is 1 Central Time. And so is that one thing I want to know is that I'm not just going to wait until everybody asks questions at the end. I'd like people to ask questions throughout this presentation. And what that means then is that I think I can see them. I'm not sure if I can see when people have questions and stuff. For some reason on my screen, I can't see that. But what I'd like you to do is just interrupt me whenever you have a question. Okay, I'm not going to wait till the end for questions. So I want people to be asking me questions throughout. And in fact, if I don't hear any questions throughout, I'll just assume that there's not a lot of interest in what I'm talking about. And so anyway, please ask questions throughout, especially since there's going to be some things I'm saying that if people have questions about, I'd like to talk more about it. So in other words, I want this to be an interactive thing, and especially since it's what you would call it, it's a small group of us. Okay, great. Okay, so let's get started. Now, I think one thing that you always have to begin these conversations with is, what do we mean by food insecurity? And I know that a lot of you know how we define food insecurity, but for those of you who don't know, I think it's good to start out there. Okay, so a food insecurity status is based upon there's 18 questions on something called the core food security module. So this has become the leading measure. I would make the argument it's become the leading measure of well-being for vulnerable households in the United States today. And it's been on surveys since the mid-90s. It's been on a nationally representative survey, the current population survey, since 1996. And so it's really become a standard bearer of what's happening with food insecurity around the country. It's based upon 18 questions on this core food security module. Here are some examples of questions. The least severe is, I worried whether our food would run out before we got money to buy more. And then the most severe one is, did a child in the household ever not eat for a full day because you couldn't afford enough food? Okay, so this is the standard set of questions that are used. And then we say somebody is food insecure if they have 3 or more affirmative responses. Now, I'll be talking a lot about COVID later. So if you have 3 or more. Part of the problem is that a lot of people talked about these huge increases in food insecurity during COVID. And really, part of the reason why they were reporting this was they were using different measures of food insecurity and not the standard one. And also, they didn't have any pre and post comparisons of food insecurity. So what I'm going to be talking about today throughout the presentation is food insecurity under the standard measure of food insecurity. Okay. So that serves as the grounding of what we're going to be talking about in our presentation today, Now, Patty Jean, can you see when people ask questions?
Yeah, you should be able to see too, but I'll interrupt you if we have a question.
Okay, yeah, because for some reason it's showing that, yeah, please interrupt me if there's a question, because for some reason usually on the screen is I have, oh, okay, I see how that is. I see it now. Okay, I'm sorry. I didn't see it before. So if anybody does have questions, please ask them. Thank you, Patty Jean. Okay. So here's what just last week Ken was talking about, map the meal gap. And just about, not last week, I guess it was a few weeks ago, May 19th, I think, is they released the 2019. And this has been one of my, so we began this about, I think 11 years ago is when we began this. And, you know, for an academia, is a lot of the stuff that we do, well, at least that I do, nobody pays that much attention to it. It's kind of not particularly useful. But this is something that's really, really useful. Well, I take that back. It makes me sound like I'm bragging or something. But this has been used extensively by people because it provides information that's particularly pertinent. What we do is we establish for all counties in the United States the extent of food insecurity for all counties in the United States. Okay, the first question here is, Brianna, you can ask questions in the Q&A. That would be just fine. That would be just fine, a way to do that. And also, but Brianna also is that if you want to, is you can also raise your hand and ask them. Okay, I think there's a way you can raise your hand and then unmute yourself and then ask the question. Okay, either would be just fine. Okay. So then here is, so looking at this at the United States, as you'll see, you know, across Appalachia is you have really high rates of food insecurity. Across the Mississippi Delta, you have really high rates. And then across, say, the Rio Bravo is you have really high rates. Okay. And then in other parts of the country, what you see is like here, take the case North Dakota or South Dakota. These are states with overall relatively low rates of food insecurity, but you have pockets in these areas that really have high rates of food insecurity. And these, as you may imagine, are American Indian reservations. Okay. But today we're here to talk about Michigan, right? So let's narrow in on Michigan. Okay. So here's Michigan. I'm not sure if any of one of my nephews is going to University of Northern Michigan next year. I'm not sure where exactly. I know it's in the UP, but I forget where exactly. But he's going there. At any rate, it seems like a really neat school. I'm not sure if there's any grads there who went to Northern Michigan. But at any rate, here's a picture of Michigan. What you see are really high rates here in the northern part. I don't know how much of this intersects with West Michigan's service area, but in this northern part, you have really high rates. And then you have high rates across the, great. There is an NMU alum here. Excellent. Good. I'll let my nephew know, Andrew. So, and what I was wondering is, does anybody know, are at least some of these counties up here, are there American Indian reservations on those counties? Does anybody know if that's the case? Oh, it's in Marquette. Okay. Thank you. Any rate, as you have in these northern, some of these rural areas, you also have really high rates in, you know, on the other side of your state in Detroit. Okay. Okay, so Vicky Ballas has just said the Salt tribe up here is some of these areas here does have American Indian reservations up there. So overall, Michigan has slightly higher rates than the US as a whole, but you can see as throughout this is there's a lot of variety with what's happening. Now, as I mentioned before, were things bad during COVID? And I always, whenever I talk about these things, I always want to emphasize that I'm not saying COVID wasn't a big problem. But before talking about what happened during COVID is the reason why COVID didn't have a bigger impact than it did on food insecurity in the United States was for two main reasons. And then I'll talk about what actually happened. The first reason is there was a massive stimulus package. Okay, so the US government sent in, and under both the Trump administration, then followed up by the Biden administration, there was a massive amount of government funding that came into things. Therefore, a lot of people who in previous recessions may have fallen into food insecurity, this did not occur nearly as much during COVID. That's the first reason. The second reason why COVID wasn't as bad as it could have been was what happened to food prices. Food prices stayed relatively stable during COVID. Okay, they didn't spike at all. There were some shortages on supermarket shelves, but not much at all. So in other words, is despite this global pandemic, is that the strength of the US agricultural system, and for that matter, the global agricultural system, really was astounding that it wasn't worse than it otherwise could have been. It really is a testimony to, food stores, food manufacturers, and all these, not necessarily, but at any rate, all these other things that really brought this forward in terms of being really successful. So what happened during COVID, during food security? Unfortunately, we're not going to have 2020 results yet, but in conjunction with Feeding America is we have made projections for 2020. But let me first, before turning to this, let me mention 3 other things about this graph. Okay, so on this axis is we have the percentage. On this axis, we have the number of people who are food insecure. Okay, so the stuff in red is what I'll mainly be concentrating on, which is the food insecurity rate. Okay, so 2000 to 2007 were really good economic times in the United States on average, but even then, roughly 1 in 8 Americans are food insecure. Okay, so food insecurity was a serious issue even during good economic times. The second point I want to emphasize about this is that there was a huge increase during the Great Recession. Okay? Now, one thing that unfortunately, we didn't have food insecurity measurement back like in 1981 to 83. I would imagine, especially in Michigan, when it was hit really hard by that recession, we would have seen sharp spikes up during that time period. But this increase was historically the largest since we began measuring food insecurity, okay? The bad news is it spiked. The bad news was that it stayed really high up until 2014, and then it began to fall. And then the good news is in 2019, we had the lowest food insecurity rate ever, okay? So coming into COVID, we were doing great, just in the lowest rate ever. So it's really good news. Unfortunately then, is COVID came in and that led to a slight increase in food insecurity. Okay, so you saw the slight increase in food insecurity, much less than the Great Recession. And in fact, we're projecting that rates actually will be lower than they were in 2014. So yes, rates increased, but it wasn't nearly as bad as the Great Recession. And the other good news is that our projections for 2021 are such that, as opposed to here, is that you're going to have a fall in food insecurity, which puts us back almost to between 2016 and 2017. So overall, I think this is a positive story. Yes, COVID is really hard. And then if you want to see is, along with map the meal gap that Ken talked about and I showed earlier, is we also have projections there. So if you're interested in what's going to happen in a particular county or something like that, you can look at you can look at that. Okay. So overall is in part the reason why COVID doesn't have a bigger impact in the near term was because is that you had this great government response and also low food prices. And another thing is the economy was in great shape in 2019, really incredible shape by any metric you want to talk about. And so this is part of the reason why, despite COVID, is we project this will come back to normal pretty quickly. So that's the good news about all of this. Any questions before I turn to some of the more specific determinants of food insecurity, are there any questions about that? Okay. Okay, so Andrew Chosa talked about quite a few other Indian communities. Kiwana Bay Indian Community, Bay Mills, Latvia, Desert, Hannahville, and Sault Ste. Marie. So several American Indian reservations in the UP. Okay, so there's a question here. Right, so Al notes is in Manistee, the school systems did a great job of filling in the gaps. And I think that Al is not only was the stimulus package important, but the other thing is the way food banks stepped up, absolutely, but also the school meal programs. There was a number of school meal programs that took on innovative ways of addressing food insecurity. And also is another thing that happened during COVID was the Trump administration put into place the pandemic EBT, and the Biden administration wisely continued that. Okay, so in other words, is that there was a school meals that were available for children over the summertime, which is really, really important. So yes, so a school stepped up, food bank stepped up, and then SNAP stepped up. Okay, now part of the reason why I always emphasize that COVID really wasn't that bad is so I'm talking about the good news, but now I want to talk about what some of the other determinants are of food insecurity that make this really a troubling problem. Okay, I'm going to skip over this, but come to this new one. Now, I could spend a full presentation talking about the key determinants of food insecurity, but I'm going to limit my discussion to a few key ones. Okay, the first is that Black persons in the United States have substantially higher rates of food insecurity than white persons. However, what we discovered is this really is a Midwestern issue. Okay, is that in the upper Midwest is you have incredible differences in food insecurity between Black persons and white persons. You don't see that in other parts of the country, in particular in the South, which I'll come to momentarily. So is, the quintessential, and I know that they're not in your service area, but Wayne County, which has Detroit, has really low rates of food insecurity amongst whites and incredibly high rates of food insecurity amongst Blacks. Same story holds for Cook County, which is where Chicago is. Same story holds for Hennepin County, which is where Minneapolis is. So in other words, is food insecurity amongst Black persons is an upper Midwest phenomenon. And you can really see it here, okay? So what this figure here is the number of individuals experiencing food insecurity by race, ethnicity, and census region, okay? Is that if you look at this, is if you compare Black non-Hispanic with white non-Hispanic here, okay? Well, let me first talk about this, is that the Midwest has, the Northeast has the lowest, South has the highest, but the South isn't that much higher than the Midwest, okay? But if you look specifically at Black non-Hispanics, okay, is that for white non-Hispanics is the rates are similar in the Midwest to the South. In fact, they're identical in the Midwest, in the South. However, the main reason why rates are so much higher in the Midwest is because these incredibly high rates amongst Black persons. And this is almost all in urban areas. Okay, so what it is high rates of food insecurity amongst Black persons in the United States is really a phenomenon of the segregation that took place in the northern cities over this time period. You don't see this in Atlanta. You don't see this in Houston. You don't see this in Birmingham, et cetera. Okay, so in other words, it's a dramatic change in what's happened in this. Okay, so in thinking about racial differences in food insecurity, is we should really be concentrated upon racial differences in upper Midwest cities. Another key determinant that unfortunately doesn't get nearly enough attention, and it really should be getting a lot more attention, is disability status. And this is one of the areas where I really think that food banks play a critical role, okay? Is that unfortunately in our society is those with disabilities, whether they be mental health disabilities or whether they be physical health disabilities, especially mental health disabilities, are overlooked. And if it wasn't for the great work of food banks and really reaching out to those persons, things would be a lot worse. What I'm going to do is, the leading predictor of food insecurity in the United States is not income. It's not race or ethnicity. It's not any of these other things. What it is disability status. And these next few figures really show this. Okay, so what you have here then is I'm going to be showing two sets of slides. Is we have food insecurity. These are the food insecurity rates on this axis by disability status. Okay, so looking here this is out of persons who are poor. Okay, this is the figure for people with the average poor person in the United States is that the food insecurity rate is about 35%, which is another thing that's always worth noting. The vast majority of poor people in the United States are food secure, in part because of SNAP, in part because of the food banks, but a lot of other reasons too. But in other words, the vast majority of poor people in the United States are food secure, which is great news. But it also points out, like I always tell people, poverty is not the same as food insecurity. Food insecurity is not the same as poverty. I think that's an important point that should be emphasized again and again. So, but if we break this down to those without disabilities, is you have food insecurity rates of about 28%. If you break it down for those with disabilities, it's 45%. Okay, much higher. Okay, so if you're poor with a disability, if somebody's poor with a disability, they have about a 50% chance of being food insecure. Okay, now turning to those between 100 and 200% of the poverty line. In other words, for a family of four, roughly between 25,000 and 50,000. Overall, over 20% of people in this category are food insecure. But look at disabilities. Is those with disabilities are far higher than those without disabilities. In fact, coming back to what I talked about, poverty not being the main determinant of food insecurity status, disability status, is that those with disabilities between this higher income level have food insecurity rates essentially the same as those who are poor without disabilities. We need to be talking a lot more about disability status in our country, about what we can do to help out those with disabilities. This next slide is even in some ways starker, okay? Is that we always talk in the United States about racial differences in terms of food insecurity. I think that's really important to talk about, especially when talking about cities in the upper Midwest, okay? However, look at what we see here. This has, this demonstrates those with disabilities and not without disabilities, Black persons have food insecurity rates roughly twice as high as white persons, okay? But look, white persons with a disability actually have higher rates of food insecurity than Black persons without a disability. And look at these astonishingly higher rates of food insecurity amongst Black persons with a disability. In other words, our discussion about racial differences in food insecurity in the United States is important to discuss, but really in many ways, it's an issue of disability status, okay? And so this is stark. 30% of all Black persons with a disability are food insecure. Those without disabilities, much lower rates. Okay, now for my next point. There was always this big discussion about quote unquote college hunger. Okay, people, for a while, that's all I would hear from people about how bad college hunger is. And it was always astonishing to me. Like, I always thought, this is weird. You're seeing these studies which are finding 60% of college students are food insecure. And I was always like, there's no way this is true. And there was absolutely no way that was true. And part of the problem was the people doing the research really knew nothing about food insecurity. And therefore, you're finding these astonishingly high rates. So I actually went in and did a paper to compare college students with non-college students of similar ages. Okay, so we want to compare college students who received all this attention and non-college students who were essentially ignored. So what did I find? This is astonishing. Here is the food insecurity rates amongst full-time college students, okay? So it's roughly 10%, okay? Here's the food insecurity rate for part-time students, and then here's the food insecurity rate for the general population. College students have far lower rates of, oh, I'm sorry, there's a question here. Okay, so I wanted to respond to Hank Wolf Rodriguez's question. As a food bank, how do we reach those who are disabled and food insecure? Meeting them where they are at, home delivery? Hank, I would say both. I really would say both. I think that for a lot of people with physical health disabilities, it may make it a challenge for them to get to a food pantry. It may make it a challenge for them to get to a food store. So therefore, having home delivery would be great. Similarly, with those with mental health challenges, you see a lot where people with mental health challenges find it difficult to go shopping. They find it difficult to navigate their day-to-day lives. And if that's the case, is having home delivery can make one thing a lot easier. Another way where I think food banks can really begin to help out, and this kind of goes a little bit beyond what food banks sometimes do, but there's this profound loneliness amongst some people with disabilities. In some ways, they truly are the forgotten persons in our country. those with disabilities, especially those with mental health disabilities, because they're often invisible. We don't see these things. So I think that in terms of meeting them where they're at, is even just having the contact of bringing food to somebody, engaging in fellowship with persons who are suffering from these disabilities. So yes, Hank, this is exactly the case whereby food bank can play a critical role, especially since that's not really be done in other areas. So I really think food banks can play a critical role with respect to this. Okay. Back to this thing about college students, okay? Non-college students between the ages of 18 and 25, though, look, in each of these years from 2014 to 2018, their food insecurity rates are roughly 2 times those as college students, okay? Now, I'm not saying that college hunger is a myth. There are some college students suffering from food insecurity. That's not my point. My point is, instead of talking about college hunger, we need to start talking about these non-college students. We need to be talking about that 20-year-old single mother who's struggling to put food on her table, okay? Who's not in college. We have to talk to about that 23-year-old who is working, who he may be working some dead-end jobs or maybe struggling to get ahead, okay? We need to be talking about his food insecurity status. In fact, what I always tell people when we talk about college hunger, it's not the students who are most at risk on a campus. Instead, it's the janitorial staff picking up after those students. Instead, it's the cafeteria workers who are feeding the students. They're at most risk of food insecurity. So in other words, let's stop talking about college hunger. Let's start talking about those who are vulnerable in the same age range.
Hey, Craig, can I just ask Christina Horgan to put her question in the QA? In webinars, you can't unmute.
Oh, okay. I'm sorry you can't unmute. Thank you. And once it appears there, I will respond. Okay. Thank you, Patty Jean. Okay. And the other thing that's a key determinant is high food prices. This really is testimony, again, like I said at the outset, to our amazing agricultural supply chain. Everywhere from, from farmers across your state who are growing food to serve to people, okay, to the major, food stores that serve people. I think, is it Meijer based in Michigan? Well, anyway, Meijer, Walmart, those large scale supermarkets, they're incredibly critical to our efforts to alleviate food insecurity. In other words, I always tell people is that at school, a store like Meijer, Walmart is the most important. They play an incredibly important role by supplying food to all the wonderful food banks across our country. They also play an incredibly important role by keeping food prices low. Okay. Now, are there any other, I'm going to now turn to saying how we can solve the problem of food insecurity relatively easy in our country. Any other questions before I turn to that? Okay, let's go on. Oh, here's the question. Christina asks, when we talk of food insecurity, are we also talking account of food qualities? Example, college students eating ramen noodles versus fresh veggies. So Christina, like I talked about at the outset of the presentation, is that when we measure food insecurity, what we're measuring is something very specific. In other words, people going without enough food. And the official food insecurity measure doesn't really measure the quality of meals that people are eating. We do know that the nutrient intakes of people who are food insecure are lower than those who are food secure. And that's not a surprise. So we would expect, coming back to the example we would expect, the example that Christina gives, college students eating ramen noodles versus fresh veggies. College students may be eating ramen rather than fresh veggies, okay? But if they're getting enough ramen, then they are considered to be food secure. But you want to know something? The main issue is non-college students who are eating ramen rather than fresh veggies and are food insecure. So in other words, yes, you could have differences in terms of nutrient intakes, The main thing we're talking about is food insecurity in this context. We have another question here too. So Vicky asks, couldn't Walmart help by paying a living wage to their employees? Many of their employees visit food pantries. So, I mean, Vicky, you pose a tough question. Walmart doesn't quote unquote pay a living wage. Well, actually they do now, is they're getting higher. But the good news about Walmart is they pay more than Target. I can't compare them to Meijer. They pay far more than other grocery stores. So in other words, even though Walmart may not be paying high wages, they're paying higher wages than other people in those positions. Okay, so I think that's the way the comparison should be made. Is Walmart paying more than other food stores, or are they paying the same? We could perhaps be critical of them if they were paying less than other food stores, but that's just not the case. So that's my commentary on that. The main reason why Walmart has such a big impact on reducing food insecurity is because of their lowering the food prices. Food prices are so much lower at Walmart, which then especially helps out vulnerable households. In fact, about 1/3 of all SNAP dollars were spent at Walmart. Okay. Now, the good news is that we can essentially solve the food insecurity problem in the United States, and I'm going to talk a little bit about some of this, okay? Before turning to this, I want to emphasize how incredible our food banks are across the country. My hope has come across loud and clear that I love food banks. I think food banks are in fact, I always tell people the two things that I donate money to are things, I'm Catholic through my church, my parish, I donate to my parish, and I donate to Feeding America, my local food bank, which is Eastern Illinois Food Bank. So in other words, food banks are incredible. But what I'm going to be talking about today is SNAP, and I know food bankers love SNAP, just like I love SNAP. Okay. So SNAP has been in a program in existence for over 50 years. And one nice thing about SNAP is it's available to eligible Americans of all ages. Okay. Is that there's no age restrictions on this program, it's people across the full lifespan. Okay. And it's become what we call the largest near cash assistance program. The reason it's called a near cash assistance program is because the overwhelming majority of SNAP recipients spend more on food than they get in SNAP, which means they'll just treat SNAP benefits just in essence like cash, even though they can only spend it at food stores. In essence, it functions just like cash. Okay? So it's a big program. The central goal of SNAP is to reduce food insecurity. Okay. As I always tell people, there's some good government programs, there's some neutral government programs, and there's government programs that do more damage than good. Okay. SNAP is one in that first category. It's an incredible success story. In fact, whenever somebody says government doesn't work, I said, yeah, that sometimes happens, but government does work through SNAP. And study after study after study has shown that SNAP succeeds in its efforts to reduce food insecurity. Insofar as SNAP recipients, after controlling for selection and measurement error, is they have lower rates of food insecurity than eligible non-SNAP recipients. This is an amazing program. We should be proud that we're in a country that has such an amazing program. Okay. Now, why does it succeed? What exactly makes SNAP such a successful program? The first thing it does is it provides food to those who are in need. Okay, it's a program that's giving benefits directly to those who are most in need. In other words, to use the language, it's a well-directed program. The second thing is it provides a substantial amount of money for food. Okay, now I'm going to argue momentarily that SNAP benefits should be even higher. Okay, but currently they're quite high. You know, it's $8,400 a year for a family of 4. That's a non-trivial amount of money. Okay, so yes, I'd like them to be higher, but we are providing a lot of food. Okay. The third thing is it can be used at virtually all retail food outlets in the United States. So we have a program whereby we're giving people the benefits, and then they can go to a store and use them, as opposed to some of the other programs in the United States where the benefits are there, but you can't use the benefits. I mean, housing assistance or something like this. So, but because is you can use these benefits when you go to a store. And the most important thing, and this is the main reason why I really like SNAP. For those of you who are interested, is I've written the United States doesn't have a formally defined right to food. And I think that's actually good that we don't have a right to food in a formally sense. But what I argue in a couple papers is that SNAP acts as a right to food. In other words, it acts as a right to food in the United States. And I've written about this from two perspectives, from a secular perspective. And then, as I mentioned, I'm Catholic, and I've also written about this from a Catholic perspective. It'd be really interesting to get a lot of other perspectives, like CRC is big in Western Michigan, right? Christian Reformed Church, yeah. So I mean, from other perspectives in terms of a lot of these other issues. Oh, you got Catholics there too, of course. But at any rate, is, we're thinking about this. But part of the reason why SNAP is so great is when we give people the right to food, is we need to treat people with dignity, and we need to give them the autonomy to make their own decisions. Okay? It's really hard to be struggling in a vulnerable United States. What we need to do is provide dignity and autonomy. And that means telling vulnerable households, we're going to give you the ability to make your own food choices. SNAP does that. There's almost no restrictions on what people can purchase with their SNAP benefits. In other words, it's telling people, yes, you can we think you are the right person to be making decisions for your family. Not some elitist at some public health school telling you what to do. No, you make your own decisions about what you should be purchasing. The other thing is if I'm a SNAP recipient, I can walk down the aisles with my neighbors and friends and purchase things just alongside them. I don't have to go somewhere else for this. So SNAP is just amazing over that dimension. There's another question here. Do you have any input on the stigma associated with programs like this? I know some people don't use these benefits because they're embarrassed and judged when they do. Brianna, this is a question for Brianna Kimbler. Yes, unfortunately, there is stigma oftentimes associated with SNAP. And alas, it comes from both the left and the right. Is you see a lot of conservatives who see somebody on SNAP and assume that they're in some sense lazy, and SNAP allows them to lead a lazy lifestyle. That's completely false. Is the way SNAP benefits work is that for each additional dollar you earn, your benefits are reduced by 30 cents. So if somebody's not working or working few hours, it has nothing to do with them getting SNAP, because SNAP doesn't reduce somebody's workload. Work, okay? A second group is mainly from the left, especially those in the public health community, who are really critical of poor people and the food purchasing decisions that they make. And they think that they should be judging, and they do judge what poor people make decisions with in terms of their food dollars. So you see a lot of people stigmatizing poor people by the purchases that they make. So in other words, is that yes, stigma is a huge problem. And I'm always happy whenever I hear of somebody get on a SNAP. I think it's one of the greatest things about our country is that people can get onto SNAP. Another great thing about our country is the network of food banks. But there is a stigma associated with it. A point I'm going to come back to in a little while, Brianna. Okay. Now, how can we make SNAP even better? It's great. Let's make it even better. And in a paper I wrote I wrote with Brent Kreider and John Pepper, two amazing co-authors of mine, is the first thing we propose is that there should be higher benefit levels. This is because for a lot of SNAP recipients, even though they're better off with SNAP, they're not getting enough benefits to be food secure. So what we find is that if we increase SNAP benefits by $42 per week, there would be a reduction in food insecurity of 62% among SNAP recipients. Okay, so among SNAP recipients alone, you're going to have this huge reduction in food insecurity by giving more benefits. Okay, the cost of this is $27 billion. Another issue is that there's a lot of people who are near poor who aren't eligible for SNAP. And this holds even in states with higher gross income thresholds. If I recall correctly, Michigan has a higher gross income threshold than 130% of the poverty line. And what you then see, though, is a lot of people who are eligible in their gross income are not eligible in their net income. So what we look at our paper is expanding the eligibility between those between 130 and 185% of the poverty line. If we expand eligibility to that group, is that there would be a reduction in food insecurity of another 2/3 amongst those in this category. at about a cost of $22 billion. There was some other recent work that was done by Seth Berkowitz and Hillary Seligman in a nice review paper that talked about how SNAP can be made better off, is to reduce this benefit reduction proportion. Currently, for each additional dollar that somebody earns, is they see a reduction in their SNAP benefits of 24 cents. Okay, that's, as I mentioned before, is not necessarily discouraging work. The tax is not particularly high. However, is by lowering that even more, is we'd be able to give people more SNAP benefits. That's the first thing that would happen. And even in addition, it would remove some more of this penalty of working more hours. So these are the three kind of shorter term things to make SNAP better. Okay. Now I want to propose something that just came, for those of you who are interested, I just wrote the paper that I'm going to be talking about here. As you know, is that there's been a lot of talk about something called universal basic income in the United States. Okay. That was like one of Andrew Yang's proposals. Basically so I looked at this in the concept of SNAP. And for those interested in the paper, just send me an email and I can send you a copy of the paper. I'll send you a link to it. It's open access paper. It's in the journal called Food Policy. Okay, so in this paper I looked at, said, okay, suppose every household in the United States got the maximum SNAP benefit. Okay, in other words, coming back to, I think it was Brianna's question about stigma, is everybody would get this benefit. In other words, I've been lucky in my life where I have not had to receive SNAP. My father was born before SNAP existed. He certainly would have received SNAP if he had been a little bit older. But the nice thing about it was everybody would get this program. All of us plus very wealthy people would get SNAP. So everybody would get it. Okay, that would remove a lot of stigma because everybody in line will be using their SNAP benefits. Okay, and then this would be paid with. So in other words, the question always becomes this: well, if you gave people these benefits, is that this is going to cause a huge increase in taxes? Yes, it is. I mean, that's not come to momentarily, but is that in the United States, 70% of taxes are paid by those in the top 10 percentile of income. Okay, so we have a very progressive income tax in the United States in terms of rich people pay a lot more in income taxes. Okay, and out of those in the upper half of the income distribution, they pay 97% of the taxes. Okay, those in the bottom half only pay 3%. That's great. I mean, this is great news that it's so progressive in that sense. Okay, but then in other words, is those who will be paying more in taxes are not those who are vulnerable to food insecurity. Okay, so this is what I make the assumption in this thing. Now, I consider two modifications. So UBI means everybody gets the benefit, but I consider two modifications. The first is that it's only for those for incomes with up to 400% of the population. So roughly up to, for a family of four, is up to $100,000. So everybody in a family of four with incomes below $100,000 a year would get this maximum SNAP benefit. I also propose that we increase the benefits by $42 per week. Because one of the challenges is that even when we have SNAP as a UBI, as I mentioned before, is a lot of low-income Americans, even when they're getting the maximum, can't escape food insecurity. But by increasing benefits by $42 per week. So two things is first is that making this program only up to those, the 40% of the poverty line, roughly $100,000 a year, and increase benefits by $42 per week. What's the impact? 98.2% decline in food insecurity in the United States. Okay, huge. I mean, basically, food insecurity will disappear in the United States if this was to be implemented. Okay, and the cost of this is $560 billion per year. Now, from my perspective, the main reason I did this paper was to show that, look, food insecurity is not a difficult thing to solve. We can solve it if we're willing to invest a lot of money into this. Is it solvable? We can have a discussion about whether or not it's worth it to spend that much money to alleviate food insecurity. The only thing I'm making is the point that it is possible. And it's far less than the combined stimulus package between the Trump administration and the Biden administration. And even better is that so much of both the Trump administration and the Biden administration proposals, they didn't go to poor people. A lot of this stuff did not go to poor people, whereas this would be well targeted towards those who are poor. So this then is, whenever somebody says we can't solve hunger in our country, I'm like, well, solving hunger in our country is easy. It's really straightforward and easy. All we needed to do is implement this plan. Now, there's a couple questions here. What would the role of food banks, food pantries, et cetera, be if SNAP improvements or UBI were implemented? Okay, so this is the thing is, I think from my perspective is, so whenever I'm making projections about, declines of essentially eliminated in this, I'm speaking in some ways loosely, okay? There's always going to be people who experience really difficult moments in their lives, which they need some assistance beyond what they'd be getting in SNAP, okay? I absolutely know that. That's the first way food banks can step in and provide a huge service. A second thing is the fact is that food banks can then turn more of their attention towards helping those who are most vulnerable, okay? Like I mentioned before, a lot of people with disabilities they're still gonna be struggling, and there can be so many neat things that food banks can do to help them out. Or say seniors, all these neat things that can be done. So food banks can play the critical role in terms of filling in the blanks when people are in need of assistance and directing their assistance towards those who are particularly in need. And I think that most food bankers would be like, this is fantastic. We can concentrate more so on what we do best and leave a lot of these other issues to the government. Okay. Brianna talks about a great related read other than your book. Thank you, Brianna. It's Why We Should Give Free Money to Everyone by Ruth Bergman. I haven't read that book, so I can't comment on it, but it does sound very interesting and kind of along the lines of what I say. Joseph asks, can you speak to measurements of SNAP eligibility and participation rates? How can they be used to address food insecurity? So, let me just put this into some perspective. Is among some groups in the United States, is we have really high participation rates in SNAP. For example, families with children have quite high participation rates. In other groups, though, we have surprisingly low. So, for example, take the group that I'm most concerned with are those between the ages of 50 and 59, okay? Take that group of those who are not seniors under the traditional USDA definition, but not younger. They have really high rates of food insecurity and really low rates of SNAP participation. So is that even if we can't get the SNAP as UBI, even if they don't increase SNAP benefits, one thing we can do is try to make sure more people get on to the program. And and work that we've done is every person that gets on the program is that leads to a corresponding decline in food insecurity. Not every person who gets on a SNAP is going to become food secure, okay, for various reasons. And not every person who's not on SNAP is food insecure, okay, for various reasons, or food secure. But nevertheless, is by bringing more people on the SNAP, is we would greatly reduce food insecurity in the United States. And this is one neat thing that a lot of food banks are doing now. I mean, so for example, I now live in Houston, Texas, and down here in Houston is a Houston food bank has a whole setup in order to roll people into SNAP. And that's one way that they're making it a little bit easier. Because along with stigma that some people mentioned about, the stigma of using SNAP benefits, there's a lot of something we call transaction costs that make it really hard to enter into SNAP. By removing those barriers, we can also bring more people into the program. So this is another thing that I would mention. We have 5 more minutes for questions. I always end on time. Okay, so there's something in the chat here. Okay. Oh, thank you. Thank you, Joseph. Yes, that's the article. For those you can see the chat. Hey, you found that very quickly. Okay. Yes, that's the article. And it's open access, so you can all read the article if you're interested. Okay. Abigail Lalonde says college student eligibility for SNAP was recently temporarily expanded through COVID's stimulus relief. Wondering why you think this population should be targeted if college hunger is a smaller issue than other food insecure groups, as you mentioned earlier. Okay, so Abigail, even though I mentioned earlier that food insecurity rates are far higher amongst non-college students, and I think that's why food banks should be paying a lot more attention, and I know that they already are, at helping out those in that vulnerable population, is I also agree SNAP should be easier to get for college students. What's made it a challenge for some college students is twofold. The first is that most college students, and I tell my students, your college career should be, 40 hours a week you should be spending on studying. And a lot of college students don't work beyond that because they don't have the time to do so. But if somebody's working less than 20 hours a week, it means they're considered to be unemployed, able-bodied adults without dependents, and therefore they're not eligible for SNAP. Now, in some areas of the country, including portions of Michigan, is that there's waivers for these ABOD policies. And if an area is waived, it means college students can be on the program despite not working. My policy prescription would be A, get rid of all work requirements. I think work requirements that were put into place during welfare reform were really a bad idea. SNAP is a program designed to address food insecurity. It's not a make work program. So Abigail, what I would say instead is if somebody is in college and they qualify for SNAP, have them on the program. Don't make working be a requirement of them being on the program. So that would be my response to that. Let's make it easier for everybody, including college students, to be on the program. Okay. Right. So Kay asked a question. Could you please clarify, during COVID, Feeding America West Michigan had a nearly 40% increase in poundage of food distributed, yet food insecurity remains relatively stable. If SNAP utilized UBI, would you then assume the need for food bank pounds of food would decrease? Well, yeah, I mean, I would see food banks as becoming a much more, still delivering a lot of food to people. Absolutely. As I mentioned, there's always going to be people in need. But if SNAP was expanded, food banks could turn to other things to help improve the well-being of people who are vulnerable to food insecurity. So I assume that they would need. One comment about the amount of pounds is, yeah, across the country, and this is work I've done for Feeding America, is across the country, there's about a 50% increase in pounds of foods distributed. Again, this is really testimony to the generosity of Americans. Donations skyrocketed to food banks during COVID. My real hope is that a lot of those who have been giving to food banks now will continue to give food banks in the future, such that food banks can continue to do their amazing work. One reason, what we saw in some of the analysis that I've done for Feed America was that pounds increased. What you saw is the number of people receiving food didn't increase that much, but instead what it more so was those who were greater need were going to food banks. And this is why a lot of food banks have been talking about this now. Like, look, during COVID, we were able to help more people who needed help before COVID. We were able to help them out more during COVID, which was great news. So yeah, I mean, I think that food banks, maybe they would be the best need for food, but again, probably my UBI proposal is unlikely to be passed, unfortunately, but it would change the dynamics of the role of food banks in the United States. And I think food bankers would welcome the opportunity to change what they do. Well, my time's up. So, oh wait, there's one more question. If it's okay.
Sure, go ahead.
Okay, Brianna asks, my local food pantry in my hometown had an event where we made cookies for homebound elderly in the winter and delivered them. Is this a good example of a way we could specialize in food banks? SNAP? Yes, Brianna, that's a perfect thing. That's a perfect thing about how you can be like, look, providing care and assistance to those in a directed way who loneliness is a big problem amongst a lot of seniors in our country. And a program like that really does help alleviate their loneliness, makes it for a brighter day. So that's the type of thing that I think would be neat.
All right, well, thank you, Craig, and thanks everyone for their time.
Thank you so much, Craig. Really appreciate it.
Yeah, well, thank you, everybody. And I want to thank everybody for attending. I really do.